Good afternoon, everyone. Thank you for being on time, and we are here today for the first sharing sessions from the Nordic companies. And today we have 3 companies that will be joining us. Let me share my slides. So very good afternoon to everyone, and for a good morning to those that is in Nordic countries. So today we have 3 companies sharing with us. Starting from 3 p.m. will be Picterus, and at 4 p.m. we have Bring Care, and lastly at 5 p.m. we have Tidewave. So just a bit of information about this program. So today's session, so as I mentioned, the 3 companies, and also that the presentation structure will be that there will be 30 minutes of presentation, including demonstration for some companies, followed by 15 minutes of Q&A. So presentation for the companies are actually scheduled starting from today to the 15th of June. So we encourage all the nurses and all the healthcare providers that is attending online to share this with their colleagues and friends so that they can register on the link here. Registration is free. If you are unable to attend any of the session, please still do sign up, because we can then follow up to send you the recorded session. So if there are any challenges other than those problem statements that we are talking about today, please do email to me, then I can look out for the solution for you. Below are my contact information. So there are a total of 17 companies that will be presenting throughout this whole series. So let me start with the first presentation by Thomas Thompson from Picterus.
Thank you for the opportunity to present Picterus and our Picterus Jaundice Pro solution. And I'm here to present how we can reduce the nurses' workload, improve patient care, and streamline neonatal jaundice monitoring. So my name is Thomas Thompson. I'm the CEO of Picterus. And if we just start by saying a few words about jaundice, and I'm sure most of you are aware of this already, but 6 out of 10 newborns develop jaundice, and it's the major cause of death and brain damage in low and middle income settings, and also the #1 reason for readmission after birth in high income countries. And although most cases are benign, severe jaundice can cause lasting brain damage or even death due to the accumulation of bilirubin in the baby's blood and the liver's disability to break down the bilirubin in the first days after birth. But jaundice is easy to treat with phototherapy if it's detected early. So the screening and early detection of jaundice is really important and essential to avoid adverse outcomes and ensure timely treatment of jaundice. And if we look at neonatal jaundice in Singapore, it used to be a leading cause of neonatal death and disability. But due to the screening programs, the national screening programs that were initiated in the 60s, Singapore has been very successful in reducing deaths and disabilities and caused by the high bilirubin levels. But according to a study from 2016-17 at the KK Women and Children Hospital, jaundice is still a leading cause of emergency visits, and the national guidelines recommend that all babies are assessed for jaundice and that babies with risk factors should be monitored very closely, meaning that jaundice remains a heavy burden for the health system also in Singapore, and is expensive and labor intensive. So if we look at the current screening options for jaundice, there is visual assessment that is non-invasive and easy to implement, but also highly unreliable, with the risk of missing cases. There is also the skin readers or the transcutaneous bilirubin meters that are non-invasive and also fairly accurate, but they require investing in expensive equipment that also needs to be maintained. So there is less availability and is also more cumbersome and expensive. The gold standard and the way to diagnose jaundice is by blood samples or TSB, where blood samples are collected, meaning that this is an invasive procedure that can be distressing both for the baby and the parents. It also requires trained manpower and laboratory equipment to be carried out. And there is a risk of unnecessary, invasive, and repeated tests due to lack of effective screening. So what Picterus can offer, our solution, is easy to use, it's cost efficient, it works everywhere, and it's non-invasive. So the Picterus Jaundice Pro is a safe way to support Singapore's national screening program. So if we look at how it actually works, what you need is your smartphone with the Picterus app, the calibration card, which is a small cardboard card, and we are measuring the color of the skin by obtaining an image of the chest of the newborn using this color calibration card and the camera on the smartphone to establish the accurate bilirubin estimates and identify newborns at risk to develop hyperbilirubinemia. And unlike other screening devices, Picterus Jaundice Pro doesn't require heavy maintenance or technicians over time. So let me show you a video.
Okay, now we'll follow with the video. We can send it to those attendees.
Yes, we can upload video. It's also available on YouTube. If you search Picterus, you will find the demo video there. So if we look at some of the science behind and look at how effective Picterus Jaundice Pro is in detecting neonatal jaundice, we have performed several clinical studies, and the figure on this slide shows the correlation between Picterus Jaundice Pro and TSB or blood samples. And this is measured in 201 babies aged 1 to 15 days, and comparing the bilirubin estimates with the gold standard, with the bilirubin measured as the bilirubin levels as measured by blood samples. And what we see is that it has a high correlation to blood samples and high sensitivity and specificity to detect neonatal jaundice. And we are now carrying out a lot of clinical trials, both in Uganda, Botswana, Nigeria, Philippines, Indonesia, Sweden, Germany, Netherlands, Norway, and the US, aiming to improve both the accuracy of the technology across different skin types, its usability across different user groups, for instance, different healthcare professionals or parents or other non-professional users, and also how it can be used in different settings, in and outpatient settings, rural, urban settings. And we are also specifically addressing how the app is performing in Asia. We have initial studies in Nepal and Indonesia that has allowed us to really assess the challenge of testing and using the app. And further studies are also on its way in Indonesia, both a validation study to assess the clinical performance in Indonesian newborns in collaboration with the university hospital, and a usability study to make the app more responsive to the needs, perception, and experience of the users. We are also addressing an implementation study to assess and improve the performance of the technology as a routine screening tool and evaluate its cost effectiveness in the Indonesian context. And similar studies could be designed to adapt Picterus Jaundice Pro to the Singaporean health system. If we look at the market authorization and the status regarding regulatory approvals, we have a CE clearance for our products for healthy babies that are born at term with a birth weight between 2.5 and 4.5 kilos and between 1 to 14 days old. There is currently a limitation with regard to skin type, and according to the so-called Fitzpatrick scale, we are approved for skin type 1 to 4, and we are now collecting more data to also include skin types 5 and 6. We have submitted an extension of the regulatory approval to also cover laypersons or parents. That is expected by September 22. And we are also preparing application for FDA clearance that we hope to submit this summer, with the possibility of having an FDA clearance by the end of this year or beginning of next year. So how do we think that Picterus product can be used in Singapore? Well, in the current setting, it's an additional cheaper screening tool in the primary care settings or in the hospitals or even at home visits. And in the near future, we envision that parents with remote support from a healthcare professional can do the screening and reduce the human resource burden. And looking at costs, our model is a pay-per-patient model, and estimates in Europe show that Picterus Jaundice Pro cost per patient is less than half than the price of TCB. So what is the anticipated impact of using our solution? Well, for the nurse, it will support a safe early discharge and remote monitoring of newborns. It can reduce the frequency of visits and the number of blood tests. It can also speed up the decision-making, leading to both reduced workload and improved efficiency. If we look at the consequence for newborn care, it's less invasive, babies can be safely monitored at home, and we can reduce unnecessary emergency visits, empowering the parents to care for their babies safely at home with remote support from a healthcare professional. So how do we foresee further avenues for collaboration in Singapore? Well, obviously through clinical research, we have a long tradition in working with university hospitals to assess and develop and improve our solution, both in terms of user experience, but also for software integration. We definitely think that having the results or having our solution connected to the electronic health journal and the digital solutions that are available is the right way to do this, rather than having it as a standalone product. And meaning that this can also be an expansion. We can expand this solution to other conditions for improved care at home. And for the Amplified Nurse project, we believe this is a safe, easy to use, low cost and non-invasive method to support the national screening programs in Singapore and reduce the workload and costs on nurses and the health system. and also an opportunity to raise awareness on jaundice and empower parents to care for their babies at home. So the key takeaway messages from our presentation should be that Picterus Jaundice Pro is a low-cost, easy-to-use, non-invasive technology for routine screening of neonatal jaundice. And with the knowledge we have of the healthcare system in Singapore, we think the characteristics of our product makes it well suited to support the routine screening programs in Singapore. And as we roll this out to the parents, the product can really reduce the nurse's workload, streamline newborns follow-up, and reduce costs of screening programs. Thank you.
Thank you, Thomas. Thanks for sharing. Yeah, definitely a very interesting solution. I remember that I think not just cost being lower, but I think for me more importantly is that it is less painful for the baby, especially when I remember many years ago when my little girl also had jaundice. I think jaundice is quite common in Singapore. I think it's very fantastic that we have less pain for the baby, and of course the other thing is that at least the baby can have early discharge, go back with the mother, it will be less painful. Well, I have got the video here. If I may, I will just share the video. I think we still have a bit of time. We should be able to share the video. Okay, now we'll move into our session of Q&A. So we are welcome to unmute yourself and ask question, or if not, you can also post it on the chat. In fact, we have also posted on the chat the video that I played earlier. Yeah. So it's open to the floor for questions. Okay, for Nini, there's a question here. She asked, does the solution work on the caregiver's own mobile device? Very good question.
Yes, that's a very good question. And that is definitely the idea. And we are working to whitelist to whitelist phones to work with the app. And currently we are addressing iOS, meaning that we will whitelist all iPhones within the next couple of months. And Android is a little bit more difficult due to the larger variety of solutions, but we are also working on this self-validation system that will allow an easy procedure for whitelisting. So the answer is that it will work on the caregiver's own mobile device. And I also understand that iPhone is quite commonly used in the Singaporean healthcare system. And so we will be able to cover that within a couple of months.
Thank you.
Hi, Brenda here. Can I ask whether in using the home use, whether will it be affected or impacted by any other devices, interference in the accuracy of the measurement?
What is important is to make sure that the light conditions are satisfactory, and this is something we control with the app. So I think the only thing to well be careful about is that there is good light conditions, and that's easy to test before you screen your baby. But other than that, this is like using your smartphone for any other app, which is not sort of conflicting or being influenced by any other devices.
Another question will be, Singapore is a very hot sunlight, summer time all the time. So the lights itself, direct sunlight from the window, or they have measured that close to the window, is it advisable, or you have to be a closed environment?
No, I mean, as long as you're indoors, it shouldn't be a problem. What we see is that it's better to work with more light than less light.
Okay,
So,
thank you. Thank you.
Oh, hi. I'm Daya from SKH. Can I just ask, right? Like whether if there's like any future plans to do any other monitoring tools aside to like bilirubin?
yeah, I mean, there are several things we are looking at, because we definitely think that screening for jaundice is something that is highly relevant in the first days after the baby return home. And then we would like to explore what other screenings or services could be connected to make this more of a platform or a multi-tool than just for this one specific task. The other way to think about it is to integrate this as a content in an existing platform instead of this being the platform. So we are definitely looking at that, and we'll also be very open for suggestions and collaborations if there are specific ideas or tasks that you would like to be also included.
Okay.
I see there's also a question regarding darker skin babies. And as I mentioned, currently the regulatory approval is for Fitzpatrick 1 to 4. We are, as we speak, collecting data in Uganda, and expect to have a complete data set within this summer that we think will allow us to include also Fitzpatrick 5 and 6 by the end of this year.
I mean, for Singapore, we also have Indian as one of the NST here. I think it would be good collaboration if any of the hospital is interested to collaborate with Picterus on identifying those of the higher different color scheme. Yeah.
Yes. Yeah, that would be highly welcomed. It's, I mean, this is a biophysics model as the core technology, but we're also applying machine learning to improve, and obviously the more data and the more well-described data we have, the more or the better will these models be.
I would say that the audience is free to suggest if there's anything relating to using a handphone camera to do some form of assessment through AI of the image. Then maybe Picterus can take that to the R&D and kind of review that. Any more questions? Okay, well, while you're thinking about some more questions, I'll use a bit more time. I'll share my screen and maybe share some more information from my side. So if there's anything that you want to follow up with Picterus in terms of maybe the live demonstration or more information about this product, you can contact me at this email address. My name is Nika, so it's Nika Ling at Innovation Norway. You can take that down. Anyway, this whole session will be recorded, so if you need to watch it over YouTube at your convenience, or maybe your colleague has missed it, you can just again email to me, and then I can send you the YouTube link. And our next session on the 8th of June will be from roommate, Sonata, and also Hubert. Okay, so back to Q&A. Any more questions from the floor?
Hi, this is Mark Chiyong from iKeys.
Hi, Chiong.
I have a question. I might have missed the earlier part of the presentation, so just pardon me. Is the solution able to discern between various level of severity for jaundice?
Yes, I mean, we accurately estimate the bilirubin level by using the smartphone, and then obviously knowing gestational age and weight of the baby. The national guidelines will be indicating what levels of bilirubin that will be considered within or outside acceptable limits.
Typically, at least in Singapore context, there's quite a good proliferation of baby monitors, right? And these are baby cams that we put in the bedrooms for constant monitoring of activity or like crying sound in case the parents are away from the room. Mm-hmm. Is there any plans to look into the area of giving a more smart health kind of a baby cam instead of a handphone that will only be available to the adult when they're in the room?
Yeah, it's something we have looked into, but I think using that type of camera is not so easy for this type of screening, because you need to have the right distance and the right angle measuring the skin. So measuring from, and also we have this calibration card that you need to position on the baby's chest. So using sort of a remote camera that is already part of a monitoring solution for the baby's well-being is not really well suited for this type of screening.
Thank you so much. Appreciate the learning. Thanks.
But what we definitely, I mean, just to add on that, we definitely see it as very interesting to integrate into, I mean, if there is a platform or a setup where parents are doing sort of a comprehensive monitoring of their baby, definitely using this as an add-on or part of the content of this for this solution is something we consider highly relevant.
Because I think beyond the very young children application, some of the skin conditions does give indications of other severe diseases like liver conditions. Yes. And the whole spectrum of a use case could be much wider than young babies. And I'm sure in your R&D ideation that could already be in part of your future plans. It is really about using skin to kind of do a preemption of what could possibly be a problem with the person. Yeah.
Mm. Yeah, no, that's right. We have looked briefly into this age determination of bruises, because that's a little bit of the same processes going on in the skin in terms of So we've looked at that, and that's an interesting avenue. But I think there is, as you said, there's a lot of possibilities here.
Yeah, great. Thank you so much. Yeah.
Okay, if there's no more questions, we'll probably end the session today. But in any case, again, if you have any question, you can always email to me, Nika at Innovation Norway. And today's session, 3 p.m., of course, we have just finished Picterus. Following that, at 4 p.m., we'll have Brain Care, and then at 5 p.m., we have Tide Wave. So quite a lot of you have actually signed up for this as well. You may log out and then come back in again. Just remember, it's the same login ID. So there's no change. It's easy to log in again. Okay. So thank you, everybody. Thanks for attending this session. Thank you. Bye.
Thank you very much. Bye-bye.